coronavirus vaccine trials. They're now beginning right now in Seattle. Here to give us, well, much-needed facts about the pandemic, former White House physician, Dr. Ronny Jackson, and infectious disease specialist, Dr. Mark Mulligan. Good to see you both. Dr. Jackson, let me start with you. The ban, the public-private partnership, and now this crucial 15 days. Give us what your perspective is in terms of Italy and Iran and what we've seen in China and South Korea.
Well, I think, Sean, the president, he's done everything he's needed to do in this case. He's acted quickly and decisively. You know, he did what he always does, Sean. He went with his instincts. He put together a top-notch team, and he was criticized and ridiculed, as he usually is, and tried to be torn down by the far left and by the liberal press. And despite that, he just carried on. He did what he needed to do for our country. He, put the travel ban in place. He protected us. And, what we see going on in Italy right now and in Iran, I think is not going to happen here because of the president's quick and decisive actions. I think we're going to be more in line with what's going on in South Korea and things of that nature. We're going to see that we got on this early. The president stopped this from entering our country very quickly, and that's going to save countless American lives. And I'm proud that he's acted so quickly and decisively in all of this.
Dr. Mulligan, this is what you do. You're an infectious disease specialist. I know more about pandemics, viruses than I ever wanted to know, ever cared to know, but it is fascinating. Apparently they were able to break down the sequence of this virus faster than any other one in history. And why is that so important? And how do you see the overall picture of things?
Yeah, it really has been amazing, the speed at which science has jumped on this virus, which first appeared in December, and then by early January, the virus was identified. On January 10th, a sequence was made available by the Chinese, and that was a wonderful thing. Very quickly, the NIH took that virus sequence and created a vaccine candidate, which, as you have said on your show, went into the first human clinical trial today. So here we are just 3 months roughly after this virus was first identified.
And that's record-breaking, sir.
That is very, yeah, absolutely. That's the quickest that's ever been done. It's not, we're in a real challenge, and we'd like it to be even faster, but that is amazing.
What impact is this public-private partnership going to have? I would argue, number one, I don't like to go to hospitals, even to visit, but I do when I have sick friends, unfortunately. But I go there, it's like there are petri dishes, right? Well, if you could drive up and get tested, it's much safer, my thought.
That's right. No, I agree completely that hospital is a good place to be if you're sick, really sick. If you're mildly ill, we don't want people going there right now. And so having these public-private partnerships is huge. Particularly huge is the numbers of tests will go way up with industry involved in providing test kits. So it's very important.
Dr. Ronny Jackson will give you the last word.
Yes, sir. Sean, I just think, we just have to follow the president's lead on this. He's got the team in place to lead us out of this successfully. And I think we just follow his instructions, and we're going to be okay in this.
Is there anything else, quickly, both of you, that the president could have done sooner? Dr. Jackson first.
No, I don't think so, Sean. I think he did everything he needed to do as quickly as possible, and I think we're seeing evidence of that now. I mean, I know that we have 70 deaths right now, and I know that that's a lot.
It's going to increase with the
for the
testing.
people that are impacted by it.
Dr. Mulligan, anything the president should have done earlier or should be doing now that you see he's not doing?
Well, the one thing that has not gone as well as we would like would be the rollout of a test very widely. So, of course, retrospect is 100%, but if we could have maybe involved industry even earlier to start rolling out large numbers of tests, that would have been helpful, because we're really still not testing as many people.
I mean, that's the thing. This is a new paradigm. Why did we never do this in the past? But I've got to roll. Yeah, go ahead, real quick. Ronny.
Sean, I was going to say also, this is just an example of some of the regulations that we have in government right now that the president has been getting rid of since day one. And so here we had some in the medical community that impacted us early on. But
look at how quick they've partnered with these companies. Amazing. Roach. Oh, and why do some people demonize the Walmarts and big pharmaceuticals? They kind of help save our lives.